Welcome to the DC Perinatal Voices podcast, brought to you by the DC Perinatal Quality Collaborative. This is a new series where we shine light on the people, programs, and partnership across our hospitals and communities, all working together to improve maternal and infant health outcomes here in the district. I'm your host, Yolette Gray, Senior Director of the Maternal and Child Health Initiative at the DC Hospital Association, and I'm thrilled to welcome you to our very first episode. Today, we are honored to be joined by Dr. Melissa Fries, Director of Genetics and Fetal Medicine at MedStar Washington Hospital Center. Dr. Fries has served as the Executive Clinical Director of the DC PQC since 2020 and has played a key role in shaping our approach to advancing perinatal health equity across DC. In today's episode, she'll reflect on how we got started, the progress we've made, share important lessons from the field, and offer her perspective on what's next in the journey toward delivering high-quality, equitable care for every birthing person and family in the district. Dr. Fries, thank you so much for being with us today. How are you doing?
Thank you. I'm delighted to be here today with you.
Awesome. So glad to have you. Let's start from the beginning, Dr. Fries. How did you first get involved with the DC Perinatal Quality Collaborative? What inspired the start of this important work?
It actually goes back to when I joined the faculty here at MedStar Washington Hospital Center. I spent 26 years in the Air Force and worked in many different places around the country and did not have the experience of having mothers die in my practice. However, when I moved to my practice after retiring, I joined here at MedStar Washington Hospital Center and care for an extremely diverse and sometimes challenging group of patients. And I recognized that my experience in the Air Force was very, very different from what I was seeing now. I became the department chair in 2013 here at MedStar and started tracking the concerns that I had about why women were struggling with morbidity during their deliveries and pregnancies, why we were seeing maternal deaths. And I became involved with a group of other providers, largely through ACOG, but also in the district, principally Dr. Tamika Augusti, Dr. Constance Bohan, who were interested in developing a maternal mortality committee. With the involvement of the city council and the mayor in 2019, we were able to establish a maternal mortality committee. And I was privileged to be part of the initial committee and continue on it right now. In the maternal mortality committee, we have the responsibility for evaluating all of the maternal deaths that occur and try to find underlying explanations and areas where we could take action. And we recognized very shortly that we did not have an action agency to take care of those concerns. Our committee was able to evaluate it, but we didn't have any group that was going to be engaged in trying to make the difference. And this led to the proposal for establishing a Perinatal Quality Collaborative, which is a CDC program. And the first program was set up by the DC Hospital Association in 2020. And as you said, I was privileged to be the first clinical executive director for that. I find myself at this particular time very actively engaged still in the maternal mortality committee and having a capacity to be able to see in a broader view where my own hospital, MedStar Washington Hospital Center, is relative to the other hospitals in the district and how that is a very big collaborative that is aimed at working on the maternal health in the district. The DC Perinatal Quality Collaborative is a action arm, and it's intended on improving maternal mortality and morbidity across the District of Columbia, but in many ways focused on the areas of greatest concern, which are Wards 7 and 8. It is also focused on recognizing that many of the concerns that lead to morbidity and mortality are in fact socioeconomic, and that systemic racism has played a huge factor in recognizing the value of medical care for many people. And so one of the key goals of the PQC is to decrease that concern of systemic racism and expand inclusiveness and engagement for all members of the public.
Thank you so much, Dr. Fries, for sharing the background of how the PQC started and as well as sharing our target population. Since joining the DCPQC, what changes or progress have you seen that you are especially proud of?
I must say that my greatest pride has been the capacity to serve with such a motivated and focused group of people who are truly believers in making things better. The PQC started from ground level, so we had to build our goals. We had to build personnel. We had to set up different advisory committees, and we had to recruit among the entire DC community for members of the community that would be involved across all kinds of different agencies, as well as members of the public. And that in itself, I would say, took maybe 1 to 2 years before there was really a sense of what the committee was and what it was there to do. In that time period, we also reflected on how other perinatal quality collaboratives were working across the country. And many have utilized the American Congress of OBGYN's AIM bundles. AIM stands for the Alliance for Improvement in Maternal Care, and these bundles are focused on specific maternal problems such as hypertension, postpartum hemorrhage, substance abuse, concerns with postpartum care and maternal mental health that seem to be common factors that impact the challenges that mothers have during their pregnancy. And so we, as a group, engaged with AIM, and as a group also reviewed all of our data to form a sense on where we should start. Our intent was always to be data-driven, and we were very fortunate to have the impact from the Department of Health in the District of Columbia, which does have a lot of data from birth certificates and other surveys that would provide guidance on areas of major concerns. And with that, we were able to make choices to establish where we wanted to begin. We recognized that one of the common themes we were seeing was the theme of hypertensive disease across the board. And so that was our first choice in our AIM bundle. What we found is that when we embraced having an AIM format, we were able to get inclusive buy-in from all of the hospitals in the District of Columbia. Sibley, Georgetown University, George Washington University, Howard University Hospital, and MedStar Washington Hospital Center, of course. And we were all able to recognize, yes, this is a big concern. These are things that we want to work through. Many of the hospitals were already beginning some of their own initiatives prompted by the needs from the Joint Commission. However, the comprehensive nature of the AIM impact was able to help each of those hospitals build protocols for decreasing time to treat severe range hypertension and ensuring follow up after delivery for mothers who had persistently elevated blood pressures. I think that focusing on the hospital based areas was our first step and one of the most valuable means to address some of these major medical concerns. But all of us recognized within that is that it wasn't so much just the medical management, it was how we had to integrate ourselves into the community and how we had to increase confidence in the community, in the medical care. I've observed recently, and I have to unfortunately blame our experiences with COVID for this, is that there has been an increased lack of trust in medical care. And for us to make any real efforts, we have to have a community engagement. And that has been something that the Perinatal Quality Collaborative has been able to do. We've connected with many aspects of ongoing community projects, some that may be at Children's National, other ones that are driven by the city council or from the mayor's recommendation. And we've been able to engage with them and support and try to integrate some of their work with our medical work that we do in the hospitals.
Indeed, Dr. Fries, the word collaborative is at the very core of what we do. Why is working across hospitals, community organization, providers, and patients so essential to improving health outcomes?
I think it is particularly focused here in the district because we are a small group of hospitals, medical personnel. We're not spread over a large region like a state like Texas or California is. And so we know many of our colleagues in other hospitals, in other programs, and that's made it so that it is a smaller group to actually have to connect with, but also enables us to really become more familiar with the exact needs of our community. Um, I can give you an example of how maternal health requires more than just good medical care. I cannot, as a provider, care for a mother who goes home after having had severe preeclampsia without recognizing that mother goes home with a newborn. Perhaps she has two other children at home, and she's had to stop working to have her baby and recover. And now I'm trying as a physician to ensure that she gets her adequate medications. But until I can address what she needs for her own support for her children, for her newborn, for her health, for her finances, for her overall well-being, as well as that of her children, sometimes even things as basic as food and housing sources, those have to be addressed not just sequentially, but simultaneously. And that to me is the meaning of collaboration. We can't do things just one and one and one. We have to do it all. Or if we're not going to do that, we're not going to make a difference. And that means that we all work together in the community to try and build these separate pieces and bring them together for improving maternal health.
Completely agree with you, Dr. Freeze. With the work that we are doing are for the patients. And one of the goals of the DC PQC is centered around patient voices and community perspective. In everything that we do, we make sure the patient voice is included. Can you share how that's been built into our quality improvement work?
I think that it is an intrinsic part of that. We've made efforts to ensure that patients who've had lived experiences of the maternal morbidity challenges that we are dealing with are engaged in the Perinatal Quality Collaborative as fully vetted members, and that their voices then are eagerly sought after in terms of what did you find? What was the problem? Where did you feel that you didn't get what you need? Because it means nothing for us to do that without their engagement. It's like intellectualizing and not really looking at something truly fundamental. And so it was built into our membership requirements, our engagement in the advisory committees, and then in the active involvement of focus groups and other areas where we can try and get information from patients to say, what happened to you and what would you want to have done better? I think that if we don't start with a patient in everything that we do, then we're not really addressing their needs. We're addressing what we think are their needs, but that is always potential for bias, and unfortunately comes with its possibility of lack of inclusion and failure to have adequate recognition of diverse needs. I think starting patient first means that we know what people need or what they tell us they feel like they need, and then can try and craft solutions to help them.
Thank you so much, Dr. Freeze. I couldn't say it any better. The patient voice is critical. We are doing this work for them, and we, as the DC Perinatal Quality Collaborative, have included in every aspect, working with the hospital team to make sure that as materials are being created, making sure that their voice are included in the PDSA cycles that we are doing as well. And so thank you so much for that. And before we wrap up, could you share a little bit about what's next for you and introduce us to the new Executive Clinical Director of the DC PQC, Oscar Mims?
Certainly. For myself, I am trying to focus at this time on doing mostly clinical work and being involved in both resident and fellow education here at MedStar Washington Hospital Center, but in direct provision of care in Ward 7 at the Community of Hope. And so I feel like I'm trying to make myself put my own boots on the ground in and follow my expressed needs from patients to provide care where they need it. I've really enjoyed that opportunity and I hope to continue it in the future. But I recognize that it's really important now that we've gotten the PQC going and we have such an amazing and powerful team that I can't be everything and my own perspective is limited. So I am very delighted that our new clinical director will be Dr. Oscar Mims. I've known Dr. Mims for almost 20 years, and he himself was born and raised here in the District of Columbia. He is an undergraduate of Howard and of Howard Medical School, and he is trained in maternal fetal medicine and presently works at Georgetown University. However, one of the aspects that I find is most meaningful about Dr. Mims is that he has worked in many institutions himself here in the district, and he has had personal awareness of the medical concerns for his colleagues and his own family in the District of Columbia. Has seen the district go from its time of limitations for people of color in which hospital they could choose to where we are today, and has both the lived experience as well as the energy and the vision to work beyond that and improve maternal health throughout the district. I think he will be an ideal candidate. He's also going to be working with a younger provider, Dr. Kristen Darwin, who is going to then be learning from him in the role as well, so that there will be always continued renewal of both experiences, knowledge, and up-to-date awareness of health concerns.
Thank you, Dr. Fries. Boots on the ground. I love that. Indeed. Thank you so much, Dr. Fries, for your leadership, your insight, and your deep commitment to maternal and infant health in our community. And thank you to our listeners for joining us for the first episode of the DC Perinatal Voices. We are just getting started. We hope you'll stay with us as we continue to spotlight the people, the programs working to make birth safer, more equitable, and more just across the district. To learn more about the DC PQC, you can visit us at dcpqc.org. We'll see you next time.